our Year in the Life program, and when I told them, you know, what it was about the robocalls, they all just, you know, immediately said, "Boy, we hate those things. Don't talk to us about those." And then I played one of the calls. I played the welcome call for them, and this is no lie. They started clapping at the end of the call, which was odd. And they said if they're ever going to listen to a phone call, that would be the robocall they would listen to. So the quality of the recording is outstanding. It really is. So I mean, I could tell that story if that would be worthwhile. If you want to talk, and that's off the beaten path of redetermination, but it does speak to the quality. So for redetermination, so are we recording now?
It's recording, but
don't
worry.
Right.
And if I ever ask a question, you're not going to hear me in the interview.
Okay.
So just sort of repeat it. We can just have a dialogue, and then I'm going to send it out to a video guy to sort of clip it up.
Yep.
You know, I think that there's, you know, the quality of the work at Eliza. I think I'm trying to see how, you know, when you think of Eliza, what really sort of stands out as the real benefit of working in the partnership.
The real benefit of working with Eliza that I've seen over the past 2.5 years is really that the quality of the writing at the beginning is really, really good. So they come in with they already have a script, regardless of what the program is. We have lots of programs. We've done several programs, probably a dozen or more with Eliza. And right off the bat, the script is really, really good. And then when we start getting it in the hands of the executives and other folks in the organization with edits, they do a real good job of working through that. It's not something that's like pulling teeth. It works really, really nicely. The other thing is that we know from the voice quality, the resultant sort of call in itself, so the script is one thing, but then the voice quality and the transition between you know, components of each one of the phone calls is always very, very smooth. And we get, surprisingly, virtually no complaints from our customers, even though we do, you know, we do 30,000 calls a month sometimes. So we're doing an awful lot of phone calls and emails. And also the other thing is that when we want to move from a phone call to say, let's not send them a phone call this time if they've already gone via email, their systems can pick that up and go with the email instead of leading with the phone call first, which we know is getting to channel preference. So they have the technical expertise to pull it off. They have the good writing skills, the high quality recordings. So I can always count that it's going to be a high quality program.
Okay, can you tell me a little bit about the most successful program you've run with Eliza?
I think that the welcome call program is probably the most successful. When you think about welcoming somebody to the plan, it's a first impression kind of thing. What's really good about it is that when an enrollment form is received, 24 hours later they get a call from us letting them know that they've been enrolled. And so the call doesn't try to achieve too much, it just welcomes them to the plan, lets them know about how to get their prescription filled, because oftentimes that's the first thing that a customer needs when they get a new plan. They might not even need to see their doctor right away. They've got a prescription that they need to get carried over to the new health plan. And so that welcome call is very, 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 very successful. It's the right length. It's followed up with a very, very good email, very, very quick. And it's been driving our adoption rate of for our member web portal quite a bit. So it's been a very successful program.
Great. And how has Eliza outreached, or sort of how do I say this? I don't have this pre-planned.
No problem.
I know you said I've heard an interesting statistic of the outreach that we've done with Eliza dramatically decreased member churn.
Yeah. Well, with the redetermination process this year, how we were addressing churn and addressing the fact that we knew that a large portion of our members are going to have to go through the Medicaid redetermination process. We thought to just let Medicaid send out their packets and just let them do it, and have no reminder program in place. And we decided that it was a much better process to make sure that we didn't lose members for months and then have them come back on again. So we decided to engage in that process. And what we decided upon was to generate an IVR phone call to them, reminding them of the importance of doing it, that they're going to lose their coverage, and then follow up with an email to get them to the websites that were most important. Because of course in this state, what they didn't want, they actually didn't want them to fill out a paper application. They wanted them to go online and to fill out the online form. So we decided that it was much better than to just let the process play out, to actually to have a reminder program in place. And we've found that we've had much less churn, 70% retention in this population. And having said that, 70% when it had been an 18-month on hiatus type of program. We know that from some of the other plans they've had much higher churn. So we think that we've, by having this effort, it also shows the members that we care about their coverage, we care about them, and we've probably retained a lot of members that they might have gone to another plan.
Great. And what additional opportunities do you see to further improve member engagement in your partnership with Eliza?
So channel preference is something that that we need to see if we can't explore that more. Certainly, the IVR calls are great. It's a nice inroad, but we'd like to understand, would the member want to receive IVR calls in the future about updates to the plan, or is it via email, or is it via text, or is it something else? So we just want to further understand our members, and Eliza is right there with us to try to help us understand that. And so we're just going to work as a partnership to see what other opportunities there are. We've been collecting authorization to text members for probably about 8 months now. And it's been a 40% adoption rate, which really kind of surprises us, that they're willing to accept text messages. So we're looking for opportunities on how to use that authorization, whether it's to let them know that they haven't yet submitted their fitness reimbursement, or they've reached a deductible, or an out-of-pocket max, something like that. That lets them know that we're there to help them, we're watching it, and we just want to make sure that they have all the resources and the reminders in place to help them get the most out of their plan.
Great. Any last words?
I can't think of any.
No. All right, let me make sure I got all of that. That's why I kept
Hopefully.
looking. I was trying not to be distracted,
I know,
but I'm like, oh my god, if you did that whole
is he
thing.
looking down? Is he looking up?
No, as in there's always that fear that you're like, imagine if you didn't press the button.
Yeah, right. Well, if we have to do it again, we can do it again.
No, I'm even afraid to press stop.